adult ADHD, it's also called attention deficit hyperactive disorder. It is one of the most common mental health conditions, classified under the neurodevelopmental conditions. In simple terms, it is related to the development of the nervous system. It is a condition which is more and more recognized, in particular in the UK. And depending on the studies, there is an estimate of around 4.4% of adults suffering from this condition. Traditionally, the condition was more prevalent in males compared with females, so almost double the numbers. However, the prevalence is very likely to change over the next decade. Some of the most common symptoms that perhaps you already read are fidgeting, talking excessively, being disorganized, interrupting, being distracted, being forgetful, or unable to pay attention to details. Now, everyone in the general population would exhibit these symptoms at some point in their life. However, people suffering with ADHD are different because most likely they're having these symptoms over a longer period of time. People suffering with ADHD, they come up to my attention with multiple diagnoses, usually, such as depression, anxiety, substance abuse. My recommendation is that you make sure that you have a proper diagnosis, which should include a pre-assessment, a minimum assessment of 1.5 hours to 2 hours, and a comprehensive report that can be shared with your GP in order for you to be able to access medication in a sustainable way from your GP. The treatment for ADHD is holistic in nature. We are considering not just medication, but also behavioral therapy. Perhaps one of the most important aspects is the coaching, but also educational interventions if needed. If we are talking about numbers, once again, the prevalence of ADHD in the United States in children aged between 11 and 17, it is around 11%. Now, as children are growing up, 40 to 60% of them transitioning into the adult life, they are going to continue having this condition as adults. ASD, once again, it is a neurodevelopmental condition caused by differences in brain. People with ADHD have problems with social communication and interaction, and restrictive or repetitive behaviors or interests. Most important, people with ASD may also have different ways of learning, different ways of paying attention, or so different ways of expressing emotions and feelings. Although there is no specific treatment for this condition, it is important for the diagnosis to be established as early as possible, for the patient and the loved ones not to miss important developmental opportunities in their life. The diagnosis pathway, it is quite similar. However, it may differ depending on the service that you're trying to access. In my clinic, the journey in getting care for ADHD starts before attending the clinic, such as you will need to complete some questionnaires about the symptoms that you had during the childhood, during the adult life. And these questionnaires are usually completed by yourself, but also the loved ones when they are available, because we know sometimes it is difficult to receive feedback from your family members. During the assessment, we are going to look in a great detail in your personal life and story and journey through life, and understand the time when you were born, going through the primary school, secondary school, university, they may apply, but also looking in into a career path and jobs or personal relationships. It is not necessarily a black and white sort of an outcome of a decision. It is more understanding what areas do you struggle with the most and how we can target and address these problems. But it's not just making your symptoms better. In some circumstances, we may be able to transform these weaknesses into strengths in terms of creativity, productivity, or let's say choosing a career path. If in your position you decide to start medication, we are starting what we call a titration process. Now, this takes a different amount of time from one case to another because people respond different to medication. Usually, you're looking at the minimum of 3 follow-up appointments in finding the right medication. However, sometimes it may take longer than that. But once you're established on a certain medication, we are more than happy to support your case, and at least from our side, to complete what we call the shared care protocol with your GP. And we are more than happy to be contacted to establish this document. What the shared care protocol means for you? Well, it means a lot because that gives you access to repeat affordable prescriptions from your GP. In some situations, you may require additional documentation and support for your university, employer, or different bodies. That this piece of document is what I call extenuating circumstances. So if you do require such piece of work, I'm more than happy to support you with it. In my opinion, the future in living with ADHD, it is a good future, and I'm going to explain you why. The neurodevelopmental conditions, they have the tendency to get better as someone is getting older. What does it mean? Well, it means that half of the patients diagnosed with ADHD in the childhood may not continue to have this condition in their adult life, or they may have less symptoms. That doesn't mean that they need to stop taking medication. No, but perhaps the medication can be adjusted to a more comfortable level. The tendency is, as someone is advancing through their life, to have the symptoms more prevalent in their teens, 20s, and 30s. And what I'm seeing in my clinic, when someone is in their 40s and 50s, the tendency is for the symptoms to decline. Compared with the other mental health conditions out there, such as schizophrenia, bipolar affective disorder, they have the tendency to relapse, and each relapse becomes more and more severe with time. But as I said, the neurodevelopmental conditions are a small area of mental health which have the natural tendency to get better. The key approach is to seek help at the right time, because even though we know they are getting better, it is important in that specific period of time for you to be able to access the educational support that you need or the career opportunities that you may be looking for. So timing, it is crucial in getting help for ADHD or ASD.